Hello, I'm Kieran Lynch and welcome to Teagasc, the Teagasc Sheep Podcast. Each episode will bring latest insights, advice and technical updates for the sheep industry. In this current episode, we're going to discuss Grass Tetany or hypermagnesia in sheep. With ewes in the early stage of lactation, the difficult grazing conditions and adverse weather present a particularly high risk for Grass Tetany. We're joined by Michael Gottstein, Chief Specialist with Teagasc, who will discuss some of the predisposing factors that we encounter on farm and some of the preventive measures that can be applied at this stage of the season. Michael starts off by describing the condition and how it occurs.
Grass tetany is a common disease in lactating ewes in the springtime. It's an acute and frequently fatal condition which primarily affects lactating sheep, and it's caused by a deficiency of magnesium in the blood.
Michael, it seems to be a higher risk on some farms than others. What are the predisposing factors for it?
Yeah, so look, it's caused obviously by a lack of low blood magnesium, and the risk factors are things like bad weather conditions, anything that affects the utilisation of grass, the dry matter of grass, and the ability of them to absorb nutrients from that grass. Rapidly growing grass, so reseeds. Grass is very highly fertilised, in particular where it has got a lot of potassium fertiliser in excess of 70 kilograms per hectare. And stress, anything that stresses the ewe. So really bad weather, malnutrition, disease, being, stormy, windy conditions, exposed sites. Those are really high risk areas, and certain farms will have a lot of those that basically predispose the ewes to it more than on other farms, and those are the farms that will be very aware of grass tetany every year.
What steps can we take on farms to reduce the incidence of it?
Yeah, so the ewes need a daily supply of magnesium. It's not something they can store in their body. Generally, ewes need about 1 to 2 grams of magnesium per head per day. But the problem is under these adverse weather conditions, or when it's very stressful for the ewes and there's poor utilisation, the ability of the ewe to take up that magnesium can be halved, or even, she may need 3 times the amount of magnesium. So generally, we recommend somewhere in the region of 3 to 5 grams of magnesium daily intake for the ewes during that high stress period.
Okay, so what can we do to get that into them?
The surest way of getting that into the ewes is with the concentrate feed, so feeding a high mag nut, somewhere in the region of 5 to 10 kilos of cal mag inclusion per tonne. One would need to check with their miller as to what that is, and then depending on the inclusion rate, make sure that they're getting somewhere in the region of around 3 grams of magnesium per head per day. And that's very useful, especially in those high-risk farms where they know if there's really bad weather coming that they're going to lose ewes. Very often they will go out with a bit of meal, maybe a day or two before the bad weather, and just for the couple of days that the bad weather is there. The most common mechanism is high mag buckets or lick buckets, somewhere in the region of 10 to 12% magnesium inclusion in those buckets, and they're basically put out in the paddocks. I'd recommend 3 to 4 buckets per grazing group, so that there's lots of them scattered around the field. The problem with that system is that it's hard enough to ensure that every ewe is licking that bucket, and you will get the occasional loss in that situation. There's also magnesium bullets, so there are bullets out there, but generally they're not going to give you the daily 3 to 5 grams of magnesium. A lot of those bullets you're talking about somewhere in the region of half a gram to a gram of magnesium per day, but on low risk farms it might be enough to safeguard the ewes. And then there's pasture dusting, not very common on sheep farms, but there is that facility for people if they wanted to pasture dust cal mag, somewhere in the region of 17 kilograms of cal mag per hectare per week, and you do that every 2 weeks. You'd need to have a nice bit of grass for that to stick onto, so that's not really an option for a lot of people maybe in the springtime. The one that doesn't really work for sheep and that we use a lot in other, like in cattle systems, is treating the drinking water. So treating drinking water with magnesium for ewes is not very reliable, because in particular during very wet and adverse weather, ewes will get a lot of their water or the requirement from the grazing grass, and they won't drink a lot of water out of troughs. And in particular when you have a lot of wet weather, you'll have puddles and stuff like that they'll be drinking out of, because they don't really like the taste of the magnesium. So what we'd be saying in terms of supplementing them, number one would be, probably for most people, would be the mineral lick bucket. Second, for high risk farms, would be going in with a bit of high cal mag ration in advance of adverse weather forecasted. and then I suppose lastly the bullets and the pasture dusting.
So Michael, just if you do get a ewe that actually has gone down with grass tetany, what's the treatment method for that?
Yeah, so if you find a ewe that is still alive with grass tetany, what we need to do is very rapidly, very quickly treat the ewe with 100 millilitres of a magnesium sulfate solution, and that's given at body temperature, or warm it before you give it to the ewe in 5 to 6 locations around the body under the skin. And if the ewe is got early enough, that should save her life.
Okay, and again, of course, then go in with the other strategies you just discussed.
And then you go in with your prevention, after that.
Michael, thanks very much for that.
We're going to finish the episode up at this point. I'd like to thank Michael for taking the time out to join us. Again, grass tetany is a risk at this time of the year, particularly this season, given the difficult grazing conditions and adverse weather we're experiencing. Like most health conditions, prevention is better than the cure. Michael clearly outlined a number of preventive measures that can be employed on farm to minimise the risk of seeing grass tetany. These also need to be in place before you see a clinical case of it. Any other updates on the sheep programme, keep an eye on our Twitter page at Teagasc Sheep. I'm Kieran Lynch. Thanks for joining us in this episode of Ovicast. Don't forget to subscribe and tune in to future episodes.